The new schedule came out yesterday for this upcoming 4-week period. Jen, who needed to have a specific weekend off to go to school, and Jen, I hope you've noticed that you have, it has not happened yet for that Saturday. That's the one that you need off, right?
Yes.
We need to make sure we get some more of these ordered quickly. So it's good that both of you are here today and that we've been able to talk about flexible schedule.
If you spend a day following Esther Hanners around the 5th floor of St. Mary's Hospital, you may find yourself exhausted.
The second one that we needed that was printed in 04, 24 hours a day, 7 days a week, it is ongoing, and some of the basic things are, number one, making sure that we have the nurses to cover the patient load, and not only number of nurses, but the varying capacity of those nurses.
If Esther never put together a Rubik's Cube, she should try, because she does the equivalent with scheduling every day. And it's not enough just to get bodies on the floor.
We have a regular registered nurse, maybe 1 year out of schooling, to somebody who may have 15, 20 years of experience with other advanced degrees. And so we want to make sure that if we have a patient with a complex situation, that on that shift we will have 1 or 2 nurses who are advanced in med-surg to make sure that we can take full care of that patient.
With those patient service requirements in mind, Esther also has one other mission: to give the nurses on her floor the flexibility to take care of patients, themselves, and their families.
Interjected in that is the fact that at times our nurses have emergencies also. In fact, just this week we had one of our wonderful young nurses whose grandma was placed into hospice, and she was scheduled to work this week. So she called Monday morning and says, I think things aren't gonna go well, and so if I need to be off of the schedule this week, can I? And of course you can, you must. You know, how can she come and care for others if she hasn't felt good about caring for her own?
Flexible schedules, compassionate care, and a lot of coffee help Esther Hanners fulfill the mission of taking care of patients and her nurses.
First, we listen, and we are fully aware that unless the nurses have had time and opportunity to care for themselves and their family, then we're asking a lot for them to come in and do that for other people.